Thank you, Madam Speaker, and it is a great privilege today to rise in support of Bill C-233, an act respecting a national strategy for Alzheimer's disease and other dementias. I, of course, would like to commend the honourable member from Niagara Falls. We were speaking earlier today, and he hasn't had opportunities to bring private members' bills as a member of government for many years, and I am very both pleased and proud to be part of this effort that he is engaged in, and glad that sometimes it is the right time to do the right bill, and I believe that he has spotted this as the right time to do the right bill. I also want to, as he did, acknowledge the tremendous work of the former member for Nickel Belt, Claude Gravel. He had inspiration, he had tenacity, and he had everything right that he was doing in that bill for that time. And however, it did not pass, and I think that we have now got a chance to have a better bill and take this bill and to ensure that Canada has the appropriate strategy to deal with dementia and Alzheimer's. I also want to begin by talking very personally about my friend and my former administrator when I was a United Church minister at Eglinton St. George's United Church in Toronto. Her name is Marion Ritchie. And Marion, while she was working with us in the church, recognized that there were many people facing both dementia in their own lives and were living as caregivers with people who were suffering either early signs or even advanced signs of dementia. Marion decided to chronicle the life that she had eventually with her husband Edwin, and she wrote a book called The Long Way Home. Similar to The Long Goodbye, The Long Way Home chronicles Edwin's decline from simple mistakes in grammar or vocabulary to finally, eventually having a complete change in personality, not recognizing his family, his friends, and not being able to engage in everyday life. This book was profoundly moving for me as it was non-medical. It wasn't from a professional. It was a book simply written to inspire, to comfort, and to encourage people who had family members who were suffering from Alzheimer's disease. I haven't had the opportunity to do something legislatively about Alzheimer's, and I'm so pleased that the member for Niagara Falls has given me that opportunity and has given every member of this House the opportunity to come together to form a national strategy on dementia and Alzheimer's, and to ensure that we have a unified approach to this disease and begin to make important steps at making it different in the lives of people like Edwin and Marion. There is a real cost to dementia. It is an individual cost that people find in their families, as well as a cost to society. Right now, there is estimated over 700,000 people in Canada with dementia, including Alzheimer's. That is expected to perhaps double in the next 20 years as our population ages. And even though age in and of itself is not a cause for dementia, it is part of it. And there are other root causes for dementia, but we still have research that is absolutely necessary so that we begin to understand how it is that we can address this problem. As everyone in this chamber knows, there is no cure for dementia. We continue to wait for new drugs, new treatments, and new understandings of the brain itself. In that, I'd also like to pay great tribute to the Alzheimer's Society of Canada. It is one of several patient organizations and health charities that are working on this important issue. And I want to name two people, Mimi Lowy-Young, who is their CEO, and Debbie Benskowski, who is the number two and already runs the operation. These two women have been advocates on this disease and for people with it for many years. And I think tonight in the chamber, we recognize that often people who work in health charities and work with patients are driving some of the things that Parliament is often behind on. Last year, the World Health Organization declared that dementias are a public health priority requiring international action. This past October, health ministers at the Pan American Health Organization approved an action plan in response to the predicted rise in dementia cases across the hemisphere over the next 20 years. Among other actions, the Pan American Plan encourages member countries, including Canada, to improve and invest in research and treatments for dementias. Most recently here at home, one of the recommendations of the Special Joint Committee on Physician-Assisted Dying was to establish a national strategy on dementia. I think that's important, given the vote that we just had in this House, to recognize that end-of-life care is complex. And that report that I was proud to be a part of looked at the need to have a continuum of care. We needed to be sure we had better palliative care. We had to have better mental health strategies. We have to have better dementia care, and we have to always be sensitive to specific populations and how they are going to respond to end-of-life situations. So tonight, we are continuing on in that process and ensuring that we have the opportunity to have the very best state-of-the-art national dementia strategy of any country in the world. I also want to say, though, that we're not starting from nothing in this position in Canada. And I want to even commend the previous government for its work in dementia strategy. And it is not as though we have been doing nothing on this. The reality is that over the last 10 years, the Government of Canada has invested almost $300 million on dementia-related research through the CIHR, the Canadian Institutes of Health Research. We've had many partnerships. We are attempting to do parts of the work all around this country. What this piece of legislation does is attempts to bring them together in a national strategy so that we can form a partnership with research, with caregivers, with people living with dementia, patient groups, with experts, take international evidence, bring them together to ensure that our Minister of Health, our Department of Health, have the best resources available to ensure we have the best possible care. I'm encouraged that members on this side of the House, as I believe members on the other side of the House and all parties, are supportive of this bill. I have been hearing positive stories from each one of them, often told with stories from their own lives. They have had a parent or a partner, or they themselves have characteristics that they are worried about dementia in their own lives. And I think that we have a chance with this bill to do something historic and to come together to say that there is the possibility that provinces and territories and the federal government, that researchers and clinicians and patients together with civil society can have the best strategy possible. This bill, I think, is interesting in that it acknowledges the shared jurisdiction of the federal government and the provinces and territories. It is very clear that the delivery of health care is going to be happening at the provincial and territorial level. We are not in any way stepping on anyone's jurisdictional toes with this piece of legislation. Rather, the legislation allows the federal government, or calls upon the federal government, to consult with provinces and territories to ensure that we have the best care and know that the provinces and territories have an important part to play in this national conversation. It also pushes us at research. If there's anything that we need to acknowledge, it's that the brain is the most complicated organ in the body. I'm very proud that in Don Valley West, we have Sunnybrook Health Sciences, Sunnybrook Hospital, which is attempting to draw together with partner organizations, and there are others like Baycrest in Toronto and others across the country, bringing research, clinical expertise, and patient experience together. This bill will actually foster that information, not only top-down, but also bottom-up. We can learn from the people who are working with this every day to ensure that we have the best resources provided, we have the best research happening, and that we take the steps that Canada can be a leader in the world. I want to close by telling you about another story from my church. One of the projects that we did at Eglinton St. George's was to form a corporation that built a housing project in Toronto called Ewart Angus Homes. This is one of those creative housing projects that involved having market housing and housing for seniors, as well as 2 floors of care for people with Alzheimer's and dementia. It was just one example of people getting together to say they needed to be a caring society. If we're going to walk with people to the end of their lives, we have to have the best supports for them, the best medical research, the best care for their caregivers, and the best laws in place, the best programs in place to ensure that our country is that leader. Again, I want to thank the member for Niagara Falls for the opportunity to second this bill, and I want to encourage every member to read it as sometimes we forget to do, and to be ensure that engage in the conversation on this bill, and we look forward to your support of it. Thank you very much.
Resuming debate, reprise de débat des